Hello Pilates lovers! Welcome back to my channel, Annie Pilates Physical Therapist. Another great video to share knowledge and education on how to help your spine to be healthy. So in this video, we will discuss about lumbar stenosis, a narrowing of your canal that causes spinal cord problems and causes weakness all the way down your legs, cramping, difficulty standing and walking. So hop on your mat or your bed with some support and we'll do some Pilates/physical therapy treatment today. We are going to start lying on your back, keeping your knees bent to support your low back area. So you take a deep breath through your nose and blow through your mouth, engaging your core muscles. So first we're going to stretch with your gluteal muscles. You're going to bend your knee towards your chest. When you bend like this, it helps relieve the pressure already. And down. Take a deep breath through your nose. Pull your stomach in, engaging your core and down below. And take a deep breath through your nose and down below. Such a lovely stretch to warm up. You're having lumbar stenosis and down below. Inhale and blow. Inhale and blow. 2 more to go. We'll just do 5 reps everything today so we can cover everything about lumbar stenosis. But you can always increase it up to 10 repetitions of each leg to help the flexibility and strength of your low back area and your legs. And that's it. That's the knee to chest. The next one is your hamstrings. So if keeping your knees straight is hard, some of you might be buckled a little bit, but keeping it straight would be great to get a good stretch in your calf. And we could do some sciatic nerve glides. So when you're doing this, your sciatic nerve is being glided through and helps release the pressure on your low back and the irritation. And if you lift your head, there's more gliding going on. So you take a deep breath and down. Inhale and down. Inhale, lift and down. Keeping the other knee bent so your back is not pressured. But if this is too much for you to do, you can get a belt, a long belt, or a long blanket and do it together. And then you can do some ankle circles and clockwise and counter. It feels a lovely stretch. Now let's go to the right side and lift. Let's do this again together. Take a deep breath and blow. You can do alternating like this to feel more tension on your sciatic nerve that's really inflamed when it's getting impinged on the narrowing of your canals of your lumbar area from L1 to L5. Let's do 2 more. Take a deep breath and down. Last one. Take a deep breath and down. And let's do some circles. Take a deep breath and blow. Counterclockwise and down gently. The next stretch that you can check out, also in my info card that you can press on top of this video, is the piriformis stretching. Usually with lumbar stenosis, some of my patients and clients have piriformis syndrome because of the irritation of the nerves that passes through the muscle. You can check out my video also at the end of this video that you can check, or everything I have to share is a longer video as well. So you're going to start with figure 4, ankle on your knee, and then you're going to press down like this, and you take a deep breath and blow. This is for beginners, but if you can challenge yourself, you can hug your knees towards your chest to get a lovely stretch. You take a deep breath through your nose and down blow. We'll do 5 times. Take a deep breath. You can hold it as much as you can, up to 30 seconds. To get a lovely stretch on your deep external rotators of your muscles. And blow. Take a deep breath through your nose. And down blow. Inhale. And blow. Last one. And blow. So the other leg let's do this. Take a deep breath and blow. Inhale through your nose and down blow. Inhale, 3 and down. Inhale, 4 and down. Last one, you take a deep breath and down. So the next one, we're going to do some butterfly exercise. Keeping your knees together first, feet together, and slowly separate them. When you do this stretching, it's good for your hip flexors, your groin area. Keeping your back in neutral spine where you can still check the arch of your back. And for lumbar lordosis, then it's also nice to keep your pelvic tilted going to posterior to engage your core more. So when you do that, you're strengthening now your core more. So you take a deep breath, so you relax the muscles, each vertebrae, and do a posterior tilt, which means you're flattening your back, and it helps the lumbar stenosis patients. But some patients have more irritation as well. So if you can't do this posterior tilt, some patients are different. They have more irritation when they do that. And you can do an anterior tilt instead, and it feels like more pain are being centralized there than going down your leg. If your pain is going down more, then stop. But if your pain is going more in your back area, then you're centralizing it and it's better for you. So right now, I love the anterior tilt more, and it helps my irritation. I had a back injury years ago, and I love this stretch. It helps the irritation subsides when I walk in the malls a lot, if I've been standing for a while. And stomach in for posterior tilt together. So you take a deep breath. So it's nice massage almost on your low back area. And blow together. So what I'm doing right now, I'm doing a little bit anterior tilt on my opening and a little bit posterior tilt when I put my knees together. So you take a deep breath, engaging your core, and back to the center and blow. Feels lovely stretch. Take a deep breath, and together blow. Last one, you take a deep breath, and blow. So, we did 4 exercises already. Now this is the last one. You get a bolster, or a foam roller, or you can get a roll towel with, you can use a tape to wrap it hard together, so it's a little bit firm. Make it tight, and you're gonna put it on your gluteal area. It's almost like a self-massage stretch, and you can slowly bend your knees towards your chest. For beginners, and it feels so lovely and good. You take a deep breath through your nose and blow. But for those who are advanced like me, lift your leg up and stretch and down, blow all the way down. Such a lovely stretch. Inhale up. We'll do 10 times and blow. Feels so good on your low back area. It's like someone massaging my back area already. Just doing this lovely glides and contraction of your muscles. So you take a deep breath through your nose and blow. Inhale. And blow. Okay, let's go to the other side. Take a deep breath and blow. Inhale, we'll just do 5 repetitions so we can cover everything and slowly progress to 10. And then once your back is a little bit more controlled, you can always check my other videos that's safer back area. If you have back pain or back injuries, you can always start the beginner's Pilates. Check the info card I have up here, or at the end of my video, you can see some of my videos for end cards. Last one, you take a deep breath and blow. Whew, that was a lovely, simple exercises for anyone with lumbar stenosis. I'm hoping these exercises will help you. I made the bolster the last one because it's usually for more advanced people who are in sports or still very active, but those who are really in a lot of pain, don't do this one, and just do the simple one. Thanks again for watching me today. I'm hoping you learned a lot about your spinal health, and hopefully these lovely 5 simple stretching will help your spine feel so good for days to come and for your active lifestyle or your work if you're sitting a lot or if you got injured recently. Please like and subscribe my channel, and if you want more contents like this, ring the notification bell for future updates and videos like this. Thanks again for watching. Have a great and healthier spine and you. Bye!